Okay, well, hi everybody. My name is Kathleen Skowyra, and I'm with the National Center for Mental Health and Juvenile Justice, which is based in just about 13 years or so ago as a way to draw attention to the large numbers of youth with mental health needs that are involved in the juvenile justice system and to help respond to these youth. I'm not, unfortunately, unable to be there in person today because I have a conflict with another meeting that's scheduled for the exact same time as this meeting, but Aaron Espinoza asked me if I'd be willing to do the presentation. I've organized my remarks this morning into kind of 4 basic areas. I want to go over some of the basic background that we know in terms of that have been underway to support the dissemination of these advancements and these responses, and then a quick summary of what I consider to be some of the remaining challenges that all of us collectively who just with kind of an overview of what we know about the juvenile justice population. Just over 1.5 million youth are arrested every single year. There are approximately 600,000 youth who go in and out of secure juvenile detention. The good news on all of this is the fact that those numbers have gone down considerably from what they were 5 to 10 years or so ago. But some of the other kind of considerations estimated that close to 70% of youth in the justice system have at least one diagnosable mental health disorder. Now, our National Center for Mental Health and Juvenile Justice did a national mental health prevalence study of youth in the juvenile justice system about 7 years ago. And we did this findings that some of the other major mental health researchers like Dr. Linda Teplin and Dr. Gail Wasserman have come up with. So I think we were all feeling that we had pretty conclusive data that the vast majority of youth now involved with the juvenile justice system have a mental health disorder. Have to require immediate treatment. Most of the youth in the juvenile justice system have been the victims of some sort of traumatic experience. This is particularly high at risk for suicide as youth in the general population. So as I mentioned earlier, I think the good news overall is that the number of youth involved with the juvenile justice system is going down. And this is the result of a whole number, both with mental health and substance use needs, as well as other patterns of delinquent behavior. And this is all a very good thing. Those numbers are going down, and that is a good thing. But we're finding that it's raising some new concerns for us. And that is, some of these youth who are not going into the system, but many of these youth who are now not going into the justice system and being served and treated in community settings have mental health and substance use disorders that will need to be treated in order for these youth to stay out of the juvenile justice system. There's that treatment. The other trend that we're seeing is the fact that the majority of youth who are remaining in juvenile correctional placement, those youth who are, for whatever reason, deemed not appropriate for diversion to the community, perhaps because of the seriousness of their original offense or whatever, there's a growing sense among juvenile challenges for staff in terms of their ability to manage and oversee and ultimately care for these youth. So some new trends. I want to talk a little bit about overall some of the big time advancements. 10, 15 years ago, mental health screening that was something that was done only very sporadically and not consistently and not always with standardized, validized, specifically to be used with youth in the juvenile justice system that can be easily administered by juvenile justice system staff. And this is an amazing accomplishment. I think the MAZI is now being used in 42 states across the country. This is a huge step, and clearly the first step in treating disorders is identifying those youth that have these interventions. I think we've all heard of MST, multisystemic therapy, functional family therapy, treatment foster care, brief strategic family therapy, a lot of new interventions that have been specifically developed for youth in their homes and in their schools and in their communities. They treat youth where they live, and they also view families as the solution and not the problem. And this has been huge for the field. Not only has another major area of advancement, and the third I want to mention is just the whole issue of the new adolescent brain research that's not only expanded our knowledge of adolescent behavior, but it's also expanded our thinking about adolescent culpability and the capacity for youth to change and be rehabilitated. And as I think everyone in the room is probably well aware, this has had a major impact on the juvenile justice field. So building on these advancements, the MacArthur Foundation, the John D. and Catherine T. MacArthur Foundation, which was a national juvenile justice reform effort that was undertaken in 4 pre-selected states, competitively selected states, Pennsylvania, Illinois, reform that could be shared with other states and other communities who are interested in undertaking the same. Surprisingly, all 4 of the states involved with Models for Change identified mental health as a major challenge for juvenile justice systems. For juvenile justice systems, and this was not really issue-specific action networks, each focusing on an issue that was kind of being identified consistently across all 4 states involved in Models for Change. But we also had the chance to invite 4 additional states to be part of this effort, and those 4 states included Colorado, Connecticut, Ohio, and the great state of Texas. So our center coordinates, but there was a lot of really great, terrific, smart people involved, including Aaron Espinoza and Vicki Spriggs and Tracy Levins and Linda Brooke, and a lot of people who were on the different topics on which to address their efforts over the next 3 years. And they're kind of similar to those issues that I mentioned earlier in terms of these areas of focus, creating more opportunities for youth to be appropriately and safely diverted out of the juvenile justice system at their earliest points of contact. Workforce development initiatives that target staff. So just move on. I want to briefly highlight the results of the Action Network. It was really an incredibly productive group, given how the short period of time they worked together and the kind of the modest resources that were offered to support this work. But diversion was the first project that we took on as a group, and there were 3 different kind of focuses through the Action Network. We had Texas, probation-based diversion model that takes juvenile probation officers who are interested in working with a specialized population, has them undergo extensive mental health training and other types of training to learn how to work with these youth. They, in turn, work with small and exclusive caseloads of youth who are identified as having mental health needs, make very specific. I know it's being actively implemented in 4 sites in Texas, and our next innovations brief is going to be on the FEDI model because we think it's that great. We had 2 states, middle school buildings, to work with youth who are brought to the attention of the school disciplinary staff who are suspected of having a mental health problem. These responders work with the youth and the family in lieu of a juvenile focus specifically on youth. I think most of you are familiar with CIT programs. They're terrific. They're in place in many police departments across the country, but most of the CIT training that's offered to police officers who are interested in CIT work is focused on adults. So our group decided to create a supplemental training that would be in addition to standard CIT training, but provide interested. And finally, we developed a diversion guidebook that just kind of provides general guidance on the creation of any type of pre-adjudicatory diversion program. Our workforce development team, of which Texas was a major player, decided to focus on the creation of a training curriculum on mental health for juvenile justice staff. So we created the mental health juvenile justice youth who are not clinicians, who don't have extensive mental health training, provides basic and critical information about development, common disorders, strategies for better interacting with these. The other training document I want to point out that's just about finished, we had to do some additional work on this, but it's a mental health training specifically for school resource officers. And unfortunately, that is becoming a topic that many, many schools are interested in. So we're just highlighted as the work that we did around family involvement. And there were kind of 2 tracks here. The group felt very, very strongly and passionately that this be a topic that we take on. I think it was the project that our group was most invested in some ways. And there were basically 2 tracks of activity. There were some states that focused on the creation of training programs for juvenile probation staff to help them better understand why it's important to work with family, movement in that direction. But these training materials were designed to support and enhance that direction. There was also states involved with the network that were less interested in focusing on the juvenile justice side of things and wanted to focus on the development of resources and materials to help families better understand what's happening when if their child has a mental health disorder. So we tried to balance with, an equal amount of resources developed for staff and an equal amount for families and youth. So we've been kind of busy getting this out. The foundation, it was a priority for the foundation that whatever innovations were developed as a result of both Models for Change and the Action Networks, the Office of Juvenile Justice and Delinquency Prevention, which is the federal juvenile justice agency, as well as SAMHSA, the Substance Abuse Mental Health Services Administration, to begin to disseminate these innovations to other states and other communities. And this map kind of gives you a visual depiction of what those in Action Networks that were kind of created as a result of our involvement in the Action Network. So we have kind of a nice reach here. There's not a lot of white states left, as you can see from this map, but there's enough to warrant some additional support. So the foundation, being extremely invested in the legacy of Models for Change, continuing once the funding is ended, proceeded to create a series of new resource centers designed to further promote the innovations coming out of Models for Change. So we created the Mental Health Juvenile Justice Collaborative for Change, which is a resource center and other support that we offer through our center. These are the kind of areas that we focus on. They largely reflect the work that occurred throughout Models for Change and within the states that were part of the Action Network. So we have screening and diversion and guidance around the implementation of evidence-based practices. We offer training on a whole variety of topics, including family involvement. There's a section on juvenile competence to stand trial that we're focusing on through our new center. We have a website. It's listed there. I would strongly encourage you all to visit and keep coming back because we're always adding new content. We have a help desk. We actually have support to provide on-site technical assistance. There's not many resource centers out there now that can do that, and we're lucky to have that. We deliver training, we put out publications, we do webinars, we do a whole variety of things. So I would strongly ask everyone in the audience to just check us out when you have a minute. So that's kind of where I think we are with a lot of the work that's been done over the last 10 years or so. I do think, though, that there are some remaining challenges that we all need to be mindful of. The system, and it is happening in a lot of systems and in a lot of states, but it's not happening consistently, and it's not happening at every key point in the juvenile justice system, and that's what we need to work towards. We have the tools, and we have the knowledge now, and pre-K, I like to talk about universal mental health screening. We need more diversion programs. We've done, I think the country as a whole and the field in particular has just done an amazing job at promoting this idea of diversion. There are fewer kids going into the juvenile justice system, and that is a good thing. And it is largely because of these diversion programs that have been set up to serve the juvenile justice system, to create more treatment capacity in the communities. We need diversion programs, but then we need something to divert these youth to. And we need these programs to be effective and safely served in the community. We need community mental health providers and substance use providers to step up to partner with the justice system to create more community-based treatment capacity. There's simply not enough treatment in the community for all the youth who need it. And if these juveniles they need, if we don't do it now, they will very likely come back either as juveniles or, even worse, as adults. And I'm in New York City. I can tell you there's not a day that goes by when I don't pick up the paper and read a story about the large number of inmates at Rikers now, or we can do it later. The next item I want to mention is the fact that there will always be some youth who, for whatever reason, are not going to be able to be diverted. And, in some ways, the juvenile correctional staff and systems would say that's okay. These are the kids that we were meant to serve. We weren't meant to serve a lot of those other kids who are no longer coming into our system. So they're in care to prepare them for their eventual and successful release back to the community. It can't all just be focused on the community. We can't forget those youth who, for whatever reason, can't be diverted, and remain in care. And finally, we just need to make sure that this is no longer viewed just as a justice problem. All of the child serving systems need to step lots of different perspectives to bear on the problem. The concern that we have is that a lot of these diversion initiatives the success of these diversion initiatives will largely be determined by systems that are not the juvenile justice systems. It will be the treatment providers and the other community-based programs that are brought in to help treat these youth in the community to make sure that these non-justice entities and system partners are at the table and contributing. So I will leave you with that. Again, I'm really disappointed that I can't be in Austin with you. It's one of my favorite places to be, and Erin is one of my favorite people, so I'm sorry that I'm not